You are listening to OBP.
Hey everybody, welcome to the Ohio Business Podcast. I'm Stephen Pohl. I'm joined with Sam Baddoo of Fleri. Well, thanks for coming here and joining the podcast.
You are listening to the Ohio Business Podcast, where we sit down and chat with today and tomorrow's business leaders of Ohio.
Thank you. It's a pleasure to finally meet in person. You know, with everything going on, it's one of those few times when we actually get to go out and then connect with people.
Yeah, it's nice to get these sit-down podcasts in the books because a lot of people, they want to do the Zoom calls, but it's a different feel when you meet up to do them. I swear, but
it makes a big difference. You know, when you actually connect in person. Mm-hmm. The conversation flows a little easier. You read visual cues that sometimes are absent when you do virtual. So yeah, I appreciate it.
Yeah. How about you give a little background on yourself and Fleri?
So myself, Sam Baddoo is my name. I was born in Ghana, West Africa. So prior to the age of 17, I lived there most of my life. At 17, I was fortunate enough to get a UN scholarship that took me to Morocco, where I spent the next 5 years of my life. Got very involved in the tech scene there, and also began to grow my knowledge and interest in social entrepreneurship. Mohammed Yunus, the Grameen Foundation, was one of my very early inspirations when it came to social entrepreneurship. And around 2012, I left to go to Ghana to start this journey of building commercially sustainable social impact businesses. That journey has, gone back and forth between Africa and North America, and finally has me here. So that's a little bit of my background. I'm pretty sure you'll have some questions that touch on more of the details there.
Mm-hmm. Well, so you've been all over, and Fleri is this business that is, well, we can just go describe Fleri.
All right, so what
you can do it better than me.
Well, I have to be able to do it better than you, or there's no business there. So Fleri is a cross-border insurance platform. It's a marketplace that brings peace of mind and financial wellness to immigrants by allowing them to be able to compare and buy health insurance products for their families back home. There are 48 million immigrant workers here in the U.S. born somewhere else. A very big part of being an immigrant is the sense of duty that you feel towards your family back home. It's an increasing challenge, especially at a time like this, to be able to maintain a decent life for yourself, but also maintain a decent life for the people who rely on you living in your home country or wherever you were born. Fleri is hoping to make that life slightly better for immigrants by giving them a more sustainable, cost-efficient, and reliable way to protect the people that they love back home.
So that's basically what inspired you to start Fleri? Is because you have family back home and you're based now here in the United States, right?
Yeah, so it's a lot of that journey and being able to understand intimately what it means to be an immigrant living in America. And to be an immigrant living anywhere, period, because people don't just move to Western countries. People travel from places like Zimbabwe to go work in South Africa, right? They still have family in Zimbabwe that they have to take care of. So it's understanding the general feeling that comes along with it, but also some very personal losses that I've had, watching family go through and navigating a health system in an emerging country, right? It comes with its own challenges, and a big part of that is how to finance quality care. And that's what inspired the work that we do at Fleri.
Yeah. So what is kind of the process back in other countries, and from the immigrant point of view in the United States, how would they normally go about the insurance process?
So insurance is an afterthought, right? So they normally don't start by thinking insurance. For tens of years, pretty much the only way you take care of your family back home is to send money. It's the reason why Western Union is as big as it has been, right? With over 260 million customers around the world, that tells you something about the people who are sending money to their families every
It's
year.
a whole global system, yeah.
Huge,
Yeah.
right? So most people just send money. We just make money transfers. Or when you have a family member, a relative, or a friend who's traveling back home, you give them a few $100s to go give to your family back. And that's how primarily we supported family back home. It's not been about insurance. We're just realizing that, that is a better way to be able to finance the care that they will inevitably need.
Now, what does Fleri change for the immigrant here?
A number of things, not just for the immigrant here, but most importantly for the people that they care about back home, right? But for the immigrant here, it means that they're no longer having to pay between 9 to 12% in transaction fees.
That's what the
Yeah.
Western Union fee is?
Oh yeah.
Wow.
And you can be not just Western Union. There's so many remittance service providers, right?
Wow.
And it's even worse when you're African because that's one of the most expensive transfer corridors in the world,
Yeah.
right? They no longer have to worry about what happens when there's an emergency for someone that I care about back home, right? Because imagine you're working a night shift like I have for many years. Your mother has a heart attack, God forbid. They rush to the hospital. Your phone is off because you're working. What happens in that gap? As they're trying to contact you, they need a deposit before the hospital is going to take care of them, right? I felt it. That anxiety, that fear, that worry that you constantly sit with, that is what changes about the immigrant experience. And then most importantly, it's knowing that preventative healthcare is now accessible for the people that you care about. Because it's one thing to have an emergency where it's a known risk, right? It's another thing for people to live with conditions and diseases that they're not aware of, killing them off slowly, right? And that's what changes about the immigrant who's over here and their peace of mind and their pocket, as they have to spend less paying premiums than they would paying the full out-of-pocket rates for healthcare for their families.
What's been the process of getting all these insurance carriers to go to work with Fleri to get this all set up? 'Cause it seems like that's a big operation,
Hectic.
Hectic, yeah.
Hectic. And, I thank God for good partners, but it's been hectic. Imagine having to navigate conversations with insurance companies who had ahead of you, from nowhere. You just pop out of the air. And you're talking about all of these things that you need to do. Regulations, we're talking external countries, right? So it's not the U.S.
U.S. is already knowing as it is.
Yeah, right? So you're talking multiple different countries. You're talking about different regulators, different insurance companies, and then underwriting, sitting with actuaries, and then having to build products that will better serve these people, understanding the premiums and the price point. So it's been a tough journey, but we've had really, really good partners that has made this possible, right? People who see the bigger vision, because this transcends, millions of people's lives that are affected in this way, right? Not just externally, the people who live abroad, the immigrants, but also for the people who live in the countries where we want to have this impact, right? So it's been hectic, but having good partnerships, having criterias, having clarity around what we're trying to achieve and what they also want out of this has been really fundamental and key to being able to get this done.
So how big is your team? Is it?
So there's a team of 5.
Okay.
We have 3 full-time, myself and then 2 co-founders. And then there's also 2 young interns who are been really, really helpful. Ohio State is represented. And everybody handling their part in this, from the research work, the marketing, the collaboration, managing partnerships, a lot of the financial calculations, budgeting, all of those things have been really fundamental to getting this done,
Mm-hmm.
right? And we're about 9 days away from the launch.
Oh wow, crunch time, huh?
Yeah, in
Yeah.
our first, country where we actually have a presence. So you look at Ghana is where we're launching in, right? And we've been working with all of these insurers for months to get to this point. It's been a lot of work, but it's been great, right?
Mhm.
Really, really great partnerships with companies that really understand what they're doing and being selective with who the partners are going to be, right? There are definitely more insurance companies than are on that platform, and that speaks to being able to find that alignment between partners.
Mm-hmm. Now, from a marketing standpoint, are you targeting potential, insurees in Ghana, or are you looking for immigrants in the United States?
So we're primarily focused on finding immigrants who have significant dependence
Mm-hmm.
in Ghana and the greater part of Africa, and I'll talk about that a little later. But primarily immigrants here with family members that they currently take care of in Ghana, right? But that's not the only thing that we're doing.
Mm-hmm.
While we know places that have high concentration of West African or African immigrants, the people who know for a fact where these people are their relatives back home.
Mm-hmm.
And so we match what we do in terms of marketing and advertising with running campaigns to spur demand in Ghana as well, right? So we're reaching beneficiaries in Ghana so they're able to get their relatives abroad to buy them these policies. And so it's a two-way marketing effort to be able to
Mm-hmm.
get this done.
Yeah. Now, does Columbus or Ohio have a big Ghana presence here?
Yeah, it does.
Okay.
It does. There are a number of associations that group them under umbrellas. We have the Ghana Dangbe, Association. There's the Ghana Council that's here, which is the foremost organization that embodies most Ghanaians who live here. There are also the various, church groups. There are lots of local Ghanaian churches here in Columbus, African markets, the stores, organizations that help with that as well.
Mm-hmm.
So there is quite a number, a good concentration of Ghanaians here.
Now, what will scaling outside of Ghana look like? Is it going to be just starting over with another country, or is there going to be less red tape because you're already implanted in Africa, or?
So it will be basically repeating a playbook with its own nuances. So
Okay.
Africa is a huge continent with 56 countries, right? Regardless of how the rhetoric usually tries to group it as one place, if you think of Africa, you could effectively crunch the United States, Europe, and several parts of the world into the same space, and you'll still have a lot of wiggle room to dance. So with regards to that, each country is unique. Scaling is primarily focused on being able to unlock those immigrant communities from different countries outside of Ghana, here in the U.S. And across the diaspora. But our business model is such that we work with insurance companies that are in these countries,
Mm-hmm.
right? So you take Ghana, you take Nigeria, you take Kenya, you take Sierra Leone, Liberia, and whatnot. And we're primarily trying to work with the insurance companies in these countries to be able to build products that will serve people in those countries, but people who have relatives abroad, such that their relatives who are here as immigrants are able to purchase these insurance products the same way they purchase their own on Fleri, so their relatives back home are able to use. So that will require us building new partnerships. It will require us navigating regulatory frameworks and navigating the local nuances of those economies to be able to scale. But more and more we're realizing what works, how to go about that, and it's going to get easier or faster to be able to replicate in different countries.
Now, is there any competition for Fleri right now outside of the obvious international carriers, but just from what you're doing, targeting just both areas and getting that signed up process?
So competition is really the status quo. It's being able to help someone understand that there is a different option than just sending money, right? And that is what our biggest task and challenge is. It's not another, cross-border insurance company. Um, that isn't it. What is competition is helping them understand that your money could go further if instead of you just sending money blindly, not knowing what it's being used for, not knowing if what it was asked for is exactly what it's going towards, not knowing whether the person that you're sending money to is going to be able to go to a qualified licensed healthcare provider, right? Not knowing what happens and being able to budget out what you're paying for healthcare for this loved one or family member, right? It's being able to educate and create awareness that there is a better option. That is what our competition really is, right? Because for tens of years, myself included, we've just been sending money. And, remittances or money transfers aren't going to go away, right? When I want to send my sister money for her birthday, it's not going to change because Fleri exists, right? But Fleri exists for particular reasons. The reasons that cause financial burdens on immigrants, right? We talk about healthcare, we talk about funerals, we talk about the burden that is left when people we love pass away and they have dependents who need to be taken care of, right? And there's a whole lot more, right, that money goes to, that we really believe that the value could be achieved in a better way, not just through sending money.
Now, is it specifically just health insurance, or is it life, PNC, as we talked about earlier? Is it just, or is it all encompassing, or?
We believe that the opportunity to go into different verticals exists, but it's obviously being strategic and focused about how we roll that out and what the market really tells us, right? We exist to help immigrants better protect the people that they love. And if that means being able to purchase a life insurance policy for your grandmother that is back home, while we would not want your grandmother to pass, it is inevitable that that's going to happen. Now, what you do have control over is what happens when that event happens, right? So are we helping you better prepare so that the funeral costs, the casket, the organization of all of that is done in a better way, right? That's something that would love to be able to help them do if that's what they want. Is it that we know that for a lot of families back home, you're taking care of more than one person at a time? So are we helping you be able to build a rainy day fund or, a last rites, fund that takes care of the family members that are left behind when someone you care about passes? If that's the direction that the market tells us, then there is an opportunity to be able to fulfill that. So that's kind of the way we look at it. We don't make assumptions about what lines will go in, but we believe that the immigrants that we work very closely with would help us navigate what's most important to them.
Seems like you guys have a lot of possibilities with that, so that's exciting.
Yeah,
That's exciting.
that's probably the biggest opportunity that we're realizing here, that there's a huge unmet need in being able to unbundle the use cases for remittance. We're just getting started. There's a huge market, and it's not just in Africa, right?
Yeah.
The immigrant experience is one that is shared, barring a few nuances, across board, right? From Southeast Asia to Latin America to Europe, to Eastern Europe, there are lots of different places where this is applicable.
Now, how has COVID affected Ghana? First off,
COVID has affected a lot of countries, differently and not in a positive way.
yeah.
We obviously talk about working from home and what that looks like, right? And while we count that as something that had to happen in places like the U.S., For lots of economies that are transactional in a human-facing way, like most parts of Africa, this is not a good thing, right? A lot of businesses have shut down. A lot of people have lost money. You have 76% of people in Ghana working in the informal sector. So these are people who don't have a steady paycheck. And even people who have a steady paycheck working for multinationals still got laid off and still had their pay frozen, right? And so it's adversely affected a lot of people. And remittances, interestingly, are acyclical, which means that when our family members back home experience greater hardship, immigrants tend to pick up the slack. They tend to have to send more, right? And that's what is happening. More than anything, COVID-19 has made Fleri more of a need than a nice to have. What happens when you have a family member who contracts COVID-19? While the test might be free, and I can tell you that the test in Ghana is not free, and most people cannot afford it, right? What happens? They have to be taken care of. They're not going to go to the hospital and get free care. Someone has to pay for it. And if it's not coming from their pocket, it's going to have to come from a loved one who cares about them. How do we help immigrants help their families in these ways, right? And that's why we carry policies that offer COVID-19 testing. We carry policies that offer COVID-19 treatment and coverage in those plans, right? So this has accelerated the need for this, not just from the health side, but there's also the efficiency. Immigrants have been disproportionately affected by this pandemic. They tend to occupy the lowest paying jobs across board. They tend to have the lowest amount of savings as well because they have so many more dependents, right? And while we tend to focus sometimes on just immigrants who are already naturalized or permanent residents, there's a large population of undocumented immigrants, asylum seekers, who don't have access to some of the public aid that is available. So some of them are not receiving stimulus checks. How are they weathering this? In addition to having to take care of their families. I know for a fact that I'd much rather take on 3 jobs and move into an apartment and lose my home than have my mother go to the hospital and not be able to care for her. And that's what the scenario is like for a lot of immigrants, right? And so this has made it a lot more important that if they don't have $300 to $400 to send every couple of months, well, maybe they should be able to pay $20, $30, or $40 a month in premiums to be able to offer care for their families back home, right? And that's how COVID-19 has affected us positively in making this a lot more timely for a lot of the immigrants that we're talking to.
Sounds like you guys are doing extremely impactful work. I mean, that was very passionate response.
Yeah, because it's the reality, right? My mom had a mild heart attack, about a month ago, right? She spent her birthday in the hospital. Navigating that is the reality of what millions of people have to go through.
Yeah.
Think of people who come here seeking asylum. They can never go back home. For these people, their whole life is going to be lived. The rest of their life is going to be lived in absentia, remotely, away from the people that they care, knew, and loved. Their only way of being able to make that a little better for them is to be able to support them, send money, provide health care, pay for school fees, right? Sponsor weddings, send gifts. What happens when they're not able to do this, right? So we know that intimately, and we want to be able to help immigrants do better because they generally want to take better care of their families back home. What's the point of leaving your homeland, traveling to a new foreign country, missing everybody that you grew up with? if it wasn't to make life a little better for you and better for them as a result, right? And that's why we're really passionate about what we do.
Mm-hmm. Wow. I don't even know how to follow up with that. That was very impactful. Yeah, I don't even know what to say to that. That's you're doing great work.
Yeah, I appreciate it.
Yeah.
I appreciate it. At the end of the day, we're going to hold ourselves accountable to the number of people who are able to receive care because of the work that we did.
Mm-hmm.
Right? At the end of the day, that's the most important metric that we look out for.
Yeah.
It's not how much money we made. It comes down to how many people now have better coverage or better health care because of the work that we were able to do. It has to come down to that.
So you're 9 days away from launch. What's that going to look like? Do you have people signed up, ready to sign up, or?
So we've been in private beta for a few weeks, the past 3 weeks, selling policies, right? So while we haven't publicly launched that, we've been working with a lot of immigrants here to get their families coverage, not just in Ghana, but across board.
Mm-hmm.
What is going to change is the fact that it's going to be a much smoother process, a much faster process, as we get to understand, these families, their needs a lot better, and hopefully 3 months from now we can move to a wholly digital experience, which leads to faster times between when you get on the site and when you're able to buy a policy for a family member who's in Ghana, Nigeria, or somewhere.
So it's not fully digital right now, or?
It's intentionally hybrid, right?
Okay.
So while it starts out as a digital experience, we talk to every single person who is buying a policy right now, right? Because the needs are not the same. We hear lots of stories. And in a way, we're also offering an opportunity for immigrants to share their experiences.
Mm-hmm.
This is not an overnight need. There are people who've encountered losses, lost relatives to different diseases, preventable diseases. It's sad to know that diabetes, right, which is highly treatable, can be left unchecked, undiagnosed, because people can't afford to just randomly go get a wellness check.
Yeah.
Right, and it's part of the reason why every policy that is purchased from Fleri has to have a preventable or preventative and wellness component, so that when you buy a policy once a year, that family member is going to have a full medical screening. Being able to know what's going on and live your life accordingly isn't a luxury. It's just the way everybody should be able to live,
Mm-hmm.
right? And that's what it's going to look like as we work from the launch to the next year when we solidify what we're doing.
So for the sign-up process, do whoever's signing up, do they get to build the insurance package they want? What's that kind of look like?
So it's a highly customized approach, very different from what insurance on the continent looks like,
Mm-hmm.
right? Which is basically, you get what you're offered. This is what the company offers, and this is what you take, right? Part of the reason why we're approaching it this way is being a marketplace brings choice. That's the very first. Different people have different needs. There's some companies that don't offer comprehensive care. We don't want to work with them to start with, right? Because we want to be able to make sure that people are getting the care that they actually need, not just the care that makes sense for an insurance company. The process itself focuses on a few things. One, it focuses on understanding where the person is and what their background looks like, right? So understanding their age, demographic data, and then the best part is being able to understand also the budgetary concerns of the person who's purchasing the insurance. Prior to this, it hasn't existed in a way. Usually the person who's buying health insurance is the person who's going to go consume it.
Mm-hmm.
Right? What we've done is to bifurcate that process, where we have a policy owner who lives in the diaspora or lives in a different country, and a policy holder who's the person who's going to consume the insurance in the home country, right? And so what that means is we need to not just consider the person who's going to use it, but also the person who's buying it. and work around those different variables to find a suitable policy.
Mm-hmm.
So we take all those things into consideration: the budget of the person who's purchasing it, the gender, age, location of the person that the policy is being purchased for, the medical conditions, so known pre-existing conditions of the person that's going to use that insurance. And then we also look at things like additional benefits that could be offered, right? So is it concierge care? Do they need a ride to be able to go to the hospital, right? Would they need emergency care because they travel a lot or they do something else? Evacuations, do they want the benefit of being able to travel outside of the African country where they live to be able to go get care somewhere in India or in South Africa or in Germany, for instance? All of this is going to play a role in being able to show them the relevant policies for them. So it's very much a customized process and not a one-cat-fits-all.
Mm-hmm. As we a couple more questions as we wrap up, how do you where do you see the insurance industry going towards in the future? Just as a whole, it doesn't have to be specifically
very, very value-based and focused on the customer. We're going to start seeing a lot more personalization as insurance companies look across board at several different data points to be able to understand what policy works for you, right, in a much faster, smoother, more personalized manner, right? So you're not going to go fill out the standard forms, right? So while you're going to have a much faster checkout, I believe, the insurance companies of the future are going to have way more information about you, information that you've carried across, right? Did you travel last year to a tropical country, right? Do you travel a lot more often? What are you posting on your social media and what you're sharing? Are you the kind of person who is focused more on adventure, right? And so do you need a much more comprehensive policy, right? Looking at all those things is going to treat you as a you. Right? There's a reason why we're looking at sports data, Fitbit, and all of that. Google starting to think of insurance and looking at ways to take that data that they know about you to better help you protect your life, right? So personalization and data-driven services from insurance companies is something that we should expect. So that's where I see it going to. And in terms of opportunity, right? Emerging countries and Africa as a whole is going to represent a huge opportunity for what can be done in insurance. Think of it. Insurance penetration in Africa is around 3%. Health insurance penetration is less than 2%.
Wow.
Health insurance penetration in Ghana is less than 1%. Right? Think about it.
There's a big market, untapped.
It's a huge market, but also it's a huge amount of creativity that is required on the part of insurance companies to be able to play in those markets. There are a lot of excuses that we throw around, right? About affordability, about a lack of understanding, cultural problems, apathy, but those are just excuses. Because if you can find a way to deliver something of value to someone that wants it, they will buy it. They will buy it if they figure out a way to be able to pay for it. It's the reason why companies like MicroInsure, it's the reason why companies like Bima are doing phenomenally well, because they keep these customers in mind. Microinsurance is going to be a big deal in Africa. And the more we play in those arenas, the more we get to interact and build solutions for people who live there that consider them, the much better their lives will be, but the much better the companies that address these problems are going to be as well.
Nice. Last question. A success and a failure on your end with Fleri and being an entrepreneur as a whole.
With success, the biggest thing I could always say, with this team in particular, I could not have asked for more, right? A team of people who are coming from different backgrounds. We all don't live in the same place, first of all. We work with people in Tunisia, work with people in Ghana. We have folks in in different cities here who are working from Boston, DC, and to be able to align everybody on the fundamental mission that we're trying to achieve, to build a company for immigrants, by immigrants, solving a problem that affects millions of people is the one biggest thing that I can say is a success, regardless of how far we get with this.
That's powerful.
Yeah, it's huge for me, and I wake up every day extremely grateful for that. A failure in my life that I'll look back at is really not having tapped into the power of alignment a lot earlier. When I was much younger, we tend to think that everything falls on your shoulders in a way, and everything depends on how smart, how connected, how much you have, right? More and more that has been debunked. It was a lot less about me than I should have realized. And I would have been a lot more successful if I had understood that, right? I've started a lot of solo companies, back home, that would have done better if I'd found a way to connect with people who understood and wanted to go in the same direction. And that's something that I take to heart. More and more, I understand the power of connecting and aligning with people over a mission, and being able to go further with that.
Is there anything you want to say to leave a note on, or just and also how can people find you and all that?
So there's a lot of things that I talk about, but especially for entrepreneurs who are starting out, a big part of the life that we live, a big part of being uncertain about your ideas and validating that, it comes from a fear, of not knowing enough. More and more I realize that knowing too much is actually a very big stumbling block.
It's crippling almost.
Yes, it is, right? There's a healthy amount of pride in not having everything figured out. I didn't start out with a background in insurance. I decided to go into insurance, study, understand the landscape, get a license, because there was a problem that I wanted to find a way to solve, right? And we need to value that. Entrepreneurs need to believe in themselves, regardless of the gap in knowledge that they think they have. And there are a lot more people who are willing to share and fill that gap than we know, if we would just reach out and talk to people about it. We all suffer from, feeling like we don't know enough. This huge issue of not understanding, what we're working in, the domain, feeling like we're not qualified enough. I couldn't overstate it. Like, I couldn't say too much about it. Like, it happens. It's real. We all have it.
Yes, myself included.
Yeah,
it's real.
But it's being able to get up and wake up every day knowing that people don't have their shit figured out.
Yeah.
And you're no different.
Yeah, you're basically, you're probably ahead of most people you think, but you're in a humbling way. But you just gotta find what you need to know and implement it, and like you said,
keep going
and connecting.
And along the way, like, the universe finds this whole way of putting the right people in touch with you.
I swear, it is a thing. It is a thing.
It is.
Once you start putting it out there, it comes in front of you, and then you finally you have the power to recognize that it's in front of you.
There's a saying in Chi, right, which is one of the 48 different languages spoken in Ghana. Wanton yaria unye wedro, right? And basically what that means is, when you don't sell your sickness, you don't find a cure.
Yeah.
It directly comes down to the reason why medical research is done. It comes down to the reason why people do lots of years of R&D, why people test for diseases that are only had by a fraction of a population. When you let people know what you're working on and what you're passionate about, the universe starts to draw the solutions that you need along the way into that journey.
Mm-hmm.
That's all you got to do. Wake up every day and do 1% more than you were doing the day before. You don't need 100% of the solution. And it's one of the things that I am so happy and appreciative that I was able to stumble upon, right? I love the people who have helped. I am no genius, right? I'm not an Elon Musk by any measure, but I love the people who've helped me get here.
And how can people find Fleri? Are you guys on social media at all?
Yes. Okay. So Fleri Health on Instagram, on Facebook, on Twitter, and LinkedIn. I'm primarily active on LinkedIn. Mm-hmm. It's about the only social media place I can handle, right? So you could always look me at Sam Baddoo on LinkedIn. I always take messages. I will always reply to messages, and I'm always down for a coffee. But most especially, I know a lot of people who always say, hey, I have a friend who's from Kenya. I have a friend who's from Nigeria. I know an immigrant, right? Hear their stories. Just talk to them and connect us, right? Just connect us, because they deal with a whole ton of stuff that most of us cannot relate with. But I think Fleri is the perfect opportunity for most people who might not know how to address immigrants, to talk to them about, hey, I heard of this company that's helping people like you take care of their families back home. We're always happy to share conversations and experiences.
Sam Baddoo, probably the most passionate person I've had on this podcast, without a doubt.
Yeah,
that was some impactful messaging, I'm telling you.
I appreciate it, and if that motivates someone to get up and then do something about the problem they think they are the only ones that have, then I'll consider it something worthwhile. I appreciate you having me here.
Yeah, love to have you back again someday. 9 days to launch. Make sure you check it out. Sam Baddoo, Fleri. Thanks for coming on.
www.joinfleri.com. Everybody can learn about us.
There you go. And then edit right there.
I want to introduce you guys to the Ohio Business Podcast first sponsor, Nextdoor. Want to earn extra cash with your extra space? There's an app for that, to Nextdoor, the marketplace for your storage space. Nextdoor is currently taking on new hosts like me. Simply visit their site, nextdoor.com, nxtstor.com, to get the app. Just think what an extra $200 a month can mean to you by simply storing your friends' boxes and mattresses. Once again, check out nextdoor.com. Thanks. The Ohio Business Podcast is sponsored by Jansen Media. Jansen Media is a website design and digital marketing agency. They develop custom strategies and solutions around client goals and business objectives. From day one, they have been focused on results, building websites that deliver more online traffic, more conversions, better user experience, easy navigation, and web functionality. You can find Jansen Media on their website at jansenmedia.com. That's spelled JANSCEN media.com. That's jansenmedia.com. Thanks.